Welcome back to American Medicine Today. Dr. Bonati and I are going to talk about the benefits of conscious IV sedation. So, Dr. Bonati, you've been implementing conscious IV sedation within the Bonati spine procedures for decades. Why is that better than, say, something like general anesthesia?
There are too many things on the patient that they require to be able to do a surgical procedure and prepare that patient to a situation that can be treated well. Mm-hmm. Initially, our problem was that the patient was too heavy. Mm-hmm. So we told patients, you need to lose weight. Mm-hmm. A patient was 400 pounds. People who has or had back pain will tell you that it's so incredible traumatic, not only because of the pain, but the limitations that that pain is going to give it to you, that practically you cannot move.
Right.
So you're asking somebody of 400 pounds to lose 200 pounds of weight. Mm-hmm. That's not going to happen. Other thing that also was when I practiced, I saw patients that they said, you need to have clear this patient for the surgery because this patient has a heart condition. So now we need to have a fight with the cardiologist that this patient needs to be operated, but the cardiologist has his own views of how this patient needs to be treated and how this patient now can be cleared for surgery or not. So a lot of those patients were discarded for surgery because the cardiovascular situation impaired this patient to have a general anesthesia.
Right.
To start to put in my mind how I am going to treat the back without really making a lot of this group of people out of the practice because I need to put the patient to sleep. Mm-hmm. Because I was lucky enough to be involved at the university using arthroscopes for knee problems.
Yeah.
We start initially thinking that I need to put those tubes on the back. I maybe need to just put some type of a local anesthesia. Mm-hmm. And if I numb the skin, probably I will be able to enter the area. But the fascia was very painful.
Right.
And the muscles were painful. And the bones have pain. So in my mind was, I would torture a patient if I do that. Yeah. I can put the tube, but once I do that, I would not be able to operate the patient because all these structures around me, they will be with a lot of pain. So I have an anesthesiologist friend who always cooperates with me. And he said to me, look, we don't need to put the patient to sleep. Mm-hmm. What we can do is numb the areas that you consider that is a problem. So what we did is we put the tubes and we numbed the area. Mm-hmm. Just put some silocaine in the area. The problem was the patient didn't have pain, but the nerves were numb. Mm-hmm. So I never knew if the patient would be better or will not.
Right.
That procedure, although give us the first intention to how do the conscious sedation,
right,
but we will have a live area inside that will impair for us to evaluate the patient's result.
Right. You know, being the patient myself who's been on the operating table where I've been fully awake, anesthetized enough so that I'm not in pain, but fully functional, and you can feel pressure on the nerves, and at times there's some discomfort, but it's nothing excruciating, and you're able to pinpoint the exact root cause of the pain.
Putting my mind that if I do it if I create a telescopic tube and I can move those tubes as a target exactly to the area that I need to operate, I minimize the damage. The tubes will control some of the pain on the tissue because I can put some type of rub some anesthetic on the tubes that they will just touch the areas of the muscle that can be sensitive.
Right.
But I still have problems. What's going to happen if I put a drill in the bone?
Right.
So talk to the anesthesiologist, and between the conversation and the decision, he said, let's sedate the patient.
Yes.
And to our surprise, the sedation of the patient allowed us not only to introduce the tubes, to bypass all the tissues that were dormant at that time, and they create pain. And to my surprise, when we use materials to work on the bone, the bone didn't really hurt. What shocked the hell of me, because I thought that the bone would be the major problem.
That's what really makes the Bonati spine procedures so effective and brings about that 98.75% patient-reported satisfaction. So thank you for delving into kind of how you came to create that and invent the notion of conscious IV sedation. And it truly is for the benefit of the patient. If you would like to hear more, you can search the Bonati Spine Institute and American Medicine Today on all your favorite streaming apps. Thank you for watching.